One.
Good evening. Chair calls to order our public health update. We welcome Dr. Moy, our health officer for Harford County Health Department. Good evening, sir.
Good evening. Can you hear me?
Just fine, sir.
Great. So thank you, Council President Vincenti, and members of the Board of Health for inviting us to provide the Health Department's Spring 2020 update. I'm here with my colleagues from the Harford County Health Department, Marcy Austin, our Deputy Health Officer, and John Resline, our Acting Environmental Health Director, to provide this update. If we could go to the next slide. So today's agenda will be an overview of Health Department services, the coronavirus COVID-19 update, and a snapshot overview of the health of Harford County residents. Next slide. So in addition, hopefully you all have from us a handout that reviews two of our accreditation efforts this year, our National FAB accreditation and our Behavioral Health CARF accreditation, both due for renewal this year. Next slide. Our health department buildings have been closed for the past 2 months, but we are still doing the best we can to offer services by the way of telephone, telehealth, and as virtually as possible. Hopefully, we'll be opening our doors in June as we plan to launch our One North Main Family Health Center that will be offering very much needed youth and adolescent mental health, women's health, dental care, WIC, care coordination, and other services in a one-stop shop site on Main Street. Next slide. And a reminder that the health department provides a wide variety of public health services. Next slide. Interestingly, when our buildings closed in early March, there was an immediate drop off in a number of services that we could provide. But by early April, many of our programs found creative ways to continue providing a pretty high level of services, so that by year's end, we still project that hundreds and thousands of people will still have been served. Next slide. What the COVID-19 crisis did highlight for us, though, was our critical population health services, including emergency preparedness, outbreak investigations, and environmental health services that don't always get the spotlight in public health. Next slide. So now turning to the coronavirus COVID-19 update, with a caveat that these numbers and recommendations are changing sometimes daily, and that many of the CDC's positions are always prefaced by the phrase, "We're still learning about this virus and how it spreads." Next slide. So to review, these are some of the basic key points about COVID-19. The disease spreads from person to person, mainly through respiratory droplets. It's an extraordinarily contagious disease. Symptoms include fever, cough, shortness of breath, chills, muscle pain, headache, sore throat, and loss of taste or smell. And there's no specific medication or vaccine currently yet available. Next slide. More basic points include that the highest risk groups are older people and those with underlying medical conditions. Preventive measures include washing your hands, covering your cough, avoiding crowds, and social distancing. And if you test positive for COVID-19, you should follow your healthcare provider's guidance, as 80% of folks will have mild to moderate symptoms and they can recover at home, where they must self-isolate for 10 days and must be fever-free and symptom-free for 3 days. Next slide. So regarding international and national COVID numbers, the most up-to-date numbers can be found at the Johns Hopkins website. And actually the numbers on this slide are already out of date. The newest numbers show that worldwide there are 4.2 million cases with 287,000 deaths, and that in the United States there are 1.3 million cases with 80,000 deaths. Next slide. Regarding state and county COVID numbers, the most up-to-date numbers can be found at the Maryland Department of Health website at coronavirus.maryland.gov. And there it shows that Maryland has 34,000 cases with 1,643 deaths. And in Harford County, we have 614 cases with 23 confirmed deaths. Next slide. In the past, we've talked about the epidemic or the epi curve that tracks the COVID infection. And here you can see that starting around April 1, the number of total cases began skyrocketing in Maryland, up over 1,000% in just 1 month. Next slide. Taking a closer look at the epi curve for Maryland's new COVID cases, though, you can see that the curve is not as clear. The question is, are the new cases plateauing? Is the epi curve flattening? That's a judgment call, as you can see. Next slide. Here's the epi curve for Harford County's total COVID cases. It's similar to the state's epi curve. There's been a 940% increase in Harford cases between April 1 and May 1. Next slide. Taking a closer look at the epi curve for Harford's new COVID cases again, you can see that curve is not as clear. Again, are the new cases plateauing? Is the epi curve flattening? Again, it's a judgment call. Next slide. For the United States as a whole, you can see that starting in mid-March, the number of new COVID cases began to skyrocket. Next slide. Similarly, for the United States, starting in mid-March, the number of COVID deaths started spiking greatly, to the point that COVID-19 is now killing more Americans each week than heart disease or cancer did on average per week in 2018. Next slide. For calendar year 2020, this spike in March and April deaths has already made COVID-19 the third leading cause of death in the United States. And if the 80,000 COVID US deaths should exceed 270,000 by the end of the calendar year, then COVID would become the #1 cause of death in this country. Next slide. Here are some Harford County specific COVID data. And this slide I prepared last week, so again, the data is now out of date. We have our most updated zip code data map that's posted daily on our local health department's website at harfordcountyhealth.com. In addition, there are some updated age-specific data for Harford County showing that those between the ages of 18 and 64 make up 66% of COVID cases, but account for only 12% of deaths. Those ages 65 or older make up 33% of cases, but account for 88% of deaths. And for those under age 18 in Harford County, so far they account for only 1% of cases and no deaths. Regarding some nursing home data, so in the state, there are 4,323 nursing home COVID cases, making up 13% of the state's cases, but 792 COVID deaths, making up 48% of the state's COVID deaths. In Harford County, there are 134 nursing home COVID cases, making up 22% of our county's COVID cases, but 12 COVID deaths in the nursing home, making up 52% of the county's COVID deaths. So you can see that the nursing homes are one of the most vulnerable populations in the county and in the state. Next slide. Here are some COVID data as of May the 8th, comparing Harford County with 10 other of the larger Maryland jurisdictions that have at least 500 COVID cases. This slide shows that after adjusting for population size, if you look at the number of COVID cases per 100,000 population, Harford County has the lowest number of cases per capita. Now, these numbers, they're going to change as we start to test more people for COVID. But next slide. So that's why this slide now looks at COVID deaths. And this one, after adjusting for population size, if you look at the number of COVID deaths per 100,000, Harford County also has the lowest number of deaths per capita. So this may be a testament to the strong collaborations among our Harford County partners and agencies, as well as a testament to the Harford County community at large. that we think in large part is taking social distancing seriously. But here's a caveat. All it takes is one inadvertent virus to spread from one seemingly healthy person to one high-risk person in a nursing home, group home, or other congregate living setting, and all of our numbers over the past 2 months could dramatically worsen in just a matter of days. So this should be important to all of us as a community, and as a community, we should be aware and be careful and be as safe as possible. Next slide. Over the past week or so, there's been a lot of talk at both the national and state levels about relaxing social distancing rules and trying to get back to normal. You see here the governor's Maryland Strong Plan that goes over the 4 pillars for recovery. That's testing, PPE, contact tracing, and hospital surge capacity. It also goes over the metrics necessary for recovery, and that includes a 14-day downward trend of benchmark metrics such as hospitalizations, intensive care unit bed usage, and COVID-19 deaths. Let me take this moment to review some key considerations as Harford County residents think about relaxing restrictions. First, we should not think about the COVID recovery as a light switch that you turn on and off. You need to use your judgment and common sense because this can be complicated and it can be confusing. For example, on May the 6th, Governor issued an executive order that states, quote, political subdivisions are not prohibited from opening outdoor public spaces to the general public, such as parks, sports fields and courts, beaches, dog parks, and playgrounds. And of course, this is all subject to social distancing guidance. But even with that governor's executive order, CDC guidance still says, and this is a quote, don't use playgrounds, including water playgrounds, located within local, state, or national parks. Using playgrounds may lead to the spread of COVID-19 because, 1, they are often crowded and could easily exceed recommended guidance for gatherings. 2, it can be challenging to keep surfaces clean and disinfected. 3, the virus can spread when young children touch contaminated equipment and then touch their hands to their eyes, nose, or mouth. End of quote. So what's an administrator for a playground supposed to do? Can you open a playground and make sure that social distancing rules are being followed? It's a tough call, and it's definitely a judgment call. Here's what you could say in Harford County. You could say that right now, Harford County's COVID numbers are good compared to other counties. Right now, Harford County residents are in large part abiding by social distancing guidelines. Right now, the community is working together using good judgment, and using good judgment is better than a government edict telling you what you can and cannot do on any given day. But this is where judgment comes in. Let's say our numbers worsen. Let's say the number of cases, and worse yet, the number of COVID deaths increases dramatically. And more specifically, let's say a case or a death takes place exactly at the location of your facility. What do you do then? Here's our advice, and this is what we will be posting to our website and recommending to all folks in the county. When it comes to visiting parks and playgrounds, you need to protect yourself and others from COVID-19. Staying physically active is a good way to keep healthy, but only if you are able to follow social distancing and other preventive measures when doing so. All children should be accompanied by an adult. Stay at least 6 feet away from others to maintain social distancing. Avoid large gatherings of more than 10 people. Wash hands or use disinfectant wipes or hand sanitizer, and think about bringing your own with you. Stay home if you're sick. Consider wearing a face covering. Come prepared. Consider bringing your own water bottle. So there's a possibility that not just for parks and playgrounds, but that more businesses and facilities will be reopening in the weeks to come. But again, it's not a light switch that you can turn on and off. It's a judgment call. The Johns Hopkins Center for Health Security, which is led by Dr. Tom Inglesby, who's been on television and is on Governor Hogan's advisory board, has created a Hopkins operational toolkit for businesses considering reopening or expanding operations in COVID-19. And that link is posted on our health department's website. The toolkit helps businesses and facilities better understand their readiness for reopening by helping them conduct a risk assessment, modification assessment, and implement mitigation measures. Just as importantly, it helps you decide what is the trigger for reassessment, the trigger for scaling back, or even possibly closing your business if things start to backslide. That's the plea to Harford County residents. Our numbers are good right now, but let's not backslide. Don't think this pandemic is over. Use your judgment to do what you can to keep us safe. Okay, next slide. These next few slides go over the metrics that the state's watching to keep tabs on COVID. These hospitalization curves crept up between mid-March and the end of April, but they have plateaued since April 30th. Now, for at least the last 12 to 13 days, they've been leveling off. Next slide. This slide shows the epi curve for Maryland COVID-19 total deaths, an over 3,000% increase in death between April 1 and May 1. Next slide. This slide shows the epi curve for Maryland COVID-19 new deaths. Again, it's not totally clear. Are the numbers of new deaths plateauing? Next slide. This slide shows the epi curve for Harford County's COVID-19 total deaths. You can see the steady increase. Next slide. This slide shows the epi curve for Harford County COVID-19 new deaths. And probably there are too few deaths in Harford County right now to even draw a conclusion from this chart. Next slide. Because there are comparatively fewer COVID deaths in Harford County, unlike the rest of the country where COVID deaths are becoming a leading cause of death overall, unless something dramatically changes in Harford County, we hope that COVID deaths will not break into the top 10 causes of death in Harford County by the end of the year. Next slide. Now I'm going to switch gears and briefly go through my slides reviewing a snapshot of the county's overall health. So of Maryland's 24 jurisdiction, what is Harford County's 2020 health ranking according to the National County Health Rankings methodology? Next slide. And the answer is Harford County is the 8th healthiest jurisdiction of Maryland's 24 jurisdictions, and we've consistently been in that top third. Next slide. Where are we doing better in the state and the national averages? Well, we're better again in infant mortality rate, teen birth rate, and the uninsured rate, just to name a few. And where are we doing worse? And it's no surprise here, still drug overdose deaths, adult smoking, and with sexually transmitted infections, we're doing better than the state average, but worse than the national average. Next slide. With infant mortality, we traditionally done better than the state, but last year we had a spike, and hopefully that was a one-year fluke, so that needs to be watched. Next slide. In any case, we know that there are racial disparities in infant mortality, and they need to be watched and addressed. Next slide. This slide is about substance-exposed newborns, and our rates are still worse than the state average. Next slide. That then leads to higher than state average rates for neonatal abstinence syndrome. Next slide. Harford County's teen birth rates consistently better than the state average. Next slide. And although the county's sexually transmitted infection rate is also better than the state average, there's been an uptick since 2013 that bears watching. Next slide. One very strong area is that our insurance enrollment unit has helped to make Harford County's uninsured rate one of the best in the state and one of the best in the country. Next slide. We believe that one of the reasons that our maternal infant numbers are generally been better is that we've had good success working with our partners in our Megan's Place Care Coordination Program for at-risk mothers and newborns. Next slide. As I mentioned earlier, we're excited about opening our one-stop shop clinical and care coordination center at 1 North Main, hopefully by next month. Next slide. Regarding our other epidemic, the drug overdose situation, as you can see, Harford County still has the 10th worst drug overdose rate in the state. Next slide. But the good news is that Harford County's opioid deaths have decreased more than 21% from 2018 to 2019, and that's the second straight year that it has gone down, and that was after 7 straight years of increases. Next slide. Mental health issues are still a concern, with Harford County's suicide mortality rate consistently higher than the state average. Next slide. Moving on to other chronic diseases, specifically tobacco use. As you can see here, Harford County's adult smoking rates have gone up and down, but still generally higher than the state average. Next slide. The good news is that Harford County's youth tobacco use has steadily decreased and is now slightly better than the state average. Next slide. Not so good news is that as Harford County's youth tobacco use rate went down, the youth vaping rate shot up, doubling between 2016 and 2018, and worse now than the state average. Next slide. Now looking at the diseases that tobacco use contributes to. For heart disease, you can see that Harford County's mortality rate has plateaued over the past 3 years, while the state average has improved. Next slide. Cancer mortality rates continue to be worse than the state average. Next slide. Chronic obstructive pulmonary disease, COPD mortality rates, they've also been consistently worse than the state average. Next slide. When it comes to diabetes, although our rates are better than the state average, you see that's been steadily worsening over the past 4 years, and that bears watching. Next slide. So in summary, Harford County has definitely made progress with reducing its opioid overdose deaths. We still need to address youth vaping and adult smoking and the diseases that are associated with those behaviors, such as heart disease, cancer, and COPD. But for now, we need to focus on strengthening our emergency preparedness and outbreak investigation, public health infrastructure over the rest of this calendar year to help us through the COVID pandemic. That is our #1 priority for now. And then next slide, I believe it's the last slide. So now we're happy to take any questions. And again, I have Marcy Austin, our Deputy Health Officer, and John Resline, our Acting Environmental Health Director. Hopefully they're also on the line to answer any of your more operational questions.
Thank you, Dr. Moy, for that update. Ms. Austin, Mr. Resline, do you have anything you'd like to add before we get into any comments or questions?
Not at the moment. Thank you.
Mr. Resline?
Nothing specific, no.
All right, well, first, let me thank you for taking my my many phone calls and emails and handling this as efficiently as you do on a daily basis. I also want to thank you for your willingness and ability to work with our business community throughout this pandemic, trying to keep them up, open, and running, and while keeping their employees and their customers safe and healthy. With that, I'm going to go to Councilman Jandriano.
Dr. Moy, thank you very much for all your efforts. I've been out of it for past couple of weeks with some back surgery. My question is on the 14-day downward trajectory or benchmark, and I think I got a little bit of information from Council President Vincenti, is our hospitalization decreasing along with our ICU bed usage decreasing? Where do we stand on that?
So I can tell you what I understand of this. Probably the folks at Upper Chesapeake give you more detailed answers, but all the hospitals in the state were told to prepare for this pandemic. And so not doing elective surgeries and being careful not to admit non-essential patients. I believe they've not reached a point where they have any problems with capacity. Now that could change now that they're talking about doing more elective surgeries and opening up. But my understanding is everything's been stable in Harford County with regard to the hospitals.
Okay, thank you very much, Dr. Moy.
Council, anyone else? Mr. Wagner?
Yeah, I would like to thank Dr. Moy and his staff for all that they've done throughout this entire pandemic that we've faced here.
You need to unmute your mic again, sir.
We're back on now. Sorry about that. The numbers of opioid deaths, as shown on a chart, has decreased. I'm pretty certain that part of that has to do with the use of naloxone, because I'm guessing that the opioid use hasn't really decreased. And if it has, my question would be, what is the next drug of choice that we're seeing coming on the horizon, if there is one?
So that's a very good point. So that I don't have that data with me right now. I know that they're talking about other drugs, cocaine, and others that might be increasing more as the opioids go down. But you're right about the naloxone probably is the major factor for the deaths decreasing. But we still think that's a great first step because those deaths were going up. So that's a great first step for right now.
Right. It has proven itself to be a great, I don't want to say a deterrent, but it certainly has affected the numbers and saved lives, which has been a great thing and a great asset to use. It just worries me that there's got to be either something else, and you know as well as I do, there's got to be something else either out there or, naloxone can't take care of the full load and make sure everybody stays safe. So we'll just keep abreast of that. And I've missed having our meetings as we did before this pandemic hit with your department talking about the drug use and the choices that we've got out there and the abuse issues that we've got. There's one other thing I wanted to ask was, do you feel that the numbers, and hear what I'm saying, the numbers for the deaths attributed to COVID-19, are they a little bit inflated due to the fact that anybody who gets ill during this time frame gets written off as a COVID death? Or are they really that specific to show that the deaths are truly attributed to COVID?
That's a good point. But I think the more important thing is that the deaths are counted uniformly. And in this state, and I believe in the country, if you've got a confirmed COVID lab test that says you're positive and it shows up on your death certificate, they're going to attribute that to a COVID-related death.
Right. Right. I'm not trying to minimize what the severity is of it. It's just that we hear so many deaths that are attributed to it that, chances are within 6 months, someone would have passed from lung cancer or something else, but they contracted COVID and they died, in this short time frame. And that's what it gets labeled. That's why I asked the question.
Yep, I agree.
Okay, thank you.
Mr. Beulah?
Yes, Dr. Moore, I would like to thank you too for, all you and your staff do. I know these are trying times and you're overworked. I won't say underpaid, but thank you. A couple of questions. I was looking at some of the data coming out of the different states. And one that if you could comment on was New York, and they were showing that 66% of the individuals that contracted the COVID virus were staying at home and social distancing. Any comments on that? Have you seen that?
No, I haven't not seen that. So I have seen some literature that says one of the safest things you can do is stay home. But when you stay home, then you're going to be home with the other folks in your household. And so that's a confined space right there. And there's a good chance that if you have somebody who's COVID positive in your house, that the others are going to get infected as well. So even though they are social distancing when they leave the house, if you're already in a house with a COVID positive person, everybody's probably going to get infected.
I just, I saw that and it's kind of a little surprising. They said that, like I said, 66, and I didn't look at the source, but it seemed reliable. Question two, and it kind of goes with this. I've been looking at a lot of the data and, as far as the whole house UV systems for your furnace. Have you any data on that? Because I know you didn't, I think one of the meetings you didn't make, and I forget the doctor's name. And I asked him and he said that Upper Chesapeake was purchasing several units for the hospital.
Are you talking about the ultraviolet light that helps kill the virus? Is that what you're talking about?
Yeah, but this is not, I know you have the light in operating rooms and but this goes into the HVAC system, the and supposedly oxidizers does something to the air. Have you any data on that, or have you looked at that at all?
No, I've heard so many things about the different ways to possibly help disinfect COVID. You hear about heat, you hear about light, you hear about a lot of things, but I don't think anything is really yet, there's consensus yet on any of these things really working the best. But you read a lot about it. I do.
Okay. Thank you. That's all, Mr. President.
Thank you, Mr. Bueller. Mr. Woods?
Thank you, Mr. President. First question is dealing with it's not COVID related. For the health inspectors, are they doing any inspections of any type right now and anything of that nature?
I think that's a good question for Mr. Resline to address. John?
So in environmental health, a lot of the inspections that are related to what we would call like our land and water resources, well permits, septic inspections, perk testing, building permits, those things are all essentially occurring with some modifications as they would have been, occurring prior to the pandemic. In our residential and commercial permit division, that also is fairly comparable to how things were prior to the pandemic. In our inspection program, we're inspecting swimming pools now in case they're permitted to open. We're inspecting camps for the same reason if they're able to open at some point in the future. And then the food service facilities, as far as those places which we license that are serving carry out and delivery curbside pickup, we were contacting them via telephone to go over some things as far as their supplies, their operations, how they were screening their employees. And recently we've been discussing doing an actual in-facility inspection at some of these places just to kind of see how they're performing in person. So we're probably 80% operations normally, and the routine food service inspections are the one exception because they're not having dine-in customers, and we're looking at some modified ways to look at them. But to answer your question, yes, a lot of inspections are occurring almost as if there was no change in circumstance.
Excellent. And with that, so if someone called with a public health concern, there's no issue. Someone's still going out to check, to investigate it and look into it.
That's correct.
Excellent. Thank you. For a list, I've a couple companies have reached out to me, and also a couple residents also reached out about a list of cleaning services. Are you providing some type of list of services that, not really a recommendation list, but of contractors or people that are out there that do sterilization or cleaning or something of that nature? COVID related.
Dr. Moy, I don't know if you've received any such phone calls, but I don't know of any calls that have come into environmental health for such a contractors list. That's not really one of those things that we have compiled. A lot of times people might ask us for people who would do mitigation for like floods or sewage overflows or things like that, but nothing specific to COVID sanitizing.
Okay. Yeah, I had at least one call where someone was questioning it and wanted to know how to get on the list. I said, I honestly don't know of any list like that, because the health department's not going to make recommendations. They would just basically give you a copy of the phone book or whatever and say, this is what's out there. But
right. And I know that there is like literature available that we distribute to the food places that we've received from, Maryland Department of Health that goes over approved sanitizers and way to sanitize your food service facilities, but I don't know of any contracting companies that were approved or being put on a list to like perform services for the facilities themselves.
Very good, thank you. And the final question is COVID related, and it deals mainly with the numbers that Maryland has on the covidvirus.maryland.gov. If for the people that haven't looked at it or do look at it, whatever, one number that no one seems to bring up that is right in the center of this is the number of negative tests. In the last 24 hours, there are 4,000 negative tests compared to 688 positive tests. So the number of confirmed cases in Maryland is 34,061. The number of negative test results are 135,442. I'm curious why no one really looks at that number or brings up that more people are negative than positive, number one. And number two, what is driving the people to get the test that makes them negative in the first place? So if we're testing people if the guideline is to test people that are showing symptoms, signs of, or whatever, or been exposed, how are we getting such a high number of negatives compared to positives?
So I think there's, as I said, the COVID world is changing a lot. So early on, the only way to get tested was you had to have symptoms. And one of the reasons for that was because there weren't really a lot of tests available. But as more testing became available, then what happened was in certain settings like nursing homes or any congregate setting, if you had one or two cases, the decision was made to test everybody there because it's a closed place and you want to figure out who's positive and who's negative, because then you want to separate or cohort those groups so you can keep the ones who are infected away from the ones who are not infected. And so that's why you have that many negatives, because once you have a high-risk place being hit, and that's where many of the COVID deaths are occurring. They're happening in those nursing homes or assisted living, in those places. You're going to get a lot of negatives. And the reason now that they're trying to test as many people as possible is because they've now learned that asymptomatic people can carry the virus. So, earlier on, the thought was you had to have symptoms. A month later, they've changed. They say, oh, now we know you can actually carry the virus 48 hours before showing any symptoms. So it's that change over the course of the last couple of months that now they're testing more people and they're having more negatives. To answer your question about why don't they talk more about the negatives, I think they will. This is the whole discussion about why testing needs to expand greatly. I think they realize that if you really expanded testing to like everybody, you'd find out that you would have a whole lot of negatives, and that would then give you a much better idea of just how prevalent is this disease, in the state, in this country. But right now, because testing was so limited before, no one has a really good idea about that yet. But the whole push now is to try to expand that testing and make that as available as possible. So as that occurs, I think they're going to start talking a lot more about those negatives, because that will tell you that'll tell you much better just how common is this thing. Because right at this moment, people don't really know, and that's the problem. Everybody they're sort of acting blindly in this situation now. So eventually, they will make a big point of those negatives.
Very good, thank you.
Thank you, Mr. Woods. Anyone else? Okay. One quick question. Mr. Resline spoke to the environmental division, but with all of our buildings being closed to the public, how are we handling other needs throughout the health department? Are we able to handle the majority of the people's needs? How are we fulfilling that?
I think that's a good question for Ms. Austin to talk about.
Yeah, sure. So our behavioral health unit that is typically on the third floor, they have moved completely to telehealth. So they're doing all their counseling from home at this point. They're able to do one-on-one counseling. They're able to do group counseling. The crisis center has offered to do the required urine screenings and Vivitrol shots. So those are being done over at the crisis center. That way we don't have anybody coming into this building. The care coordination unit, which includes MCHIP, which is insurance, Megan's Place, all of that, that entire unit has moved to teleworking. So they're all doing, if they have home visits, they've just been doing it by phone. So everybody's just learning to work a different way. Have I missed any programs?
The folks at Woodbridge and the drive-by.
Oh, yeah. Woodbridge, even though they're closed down there, they're still in the back of the building. They're still giving depot shots, and they just stay in their car, just like a drive-through, hold their arm out the window and get their shot. So they're trying to continue some of those services in any way they can figure out, really. So.
Great. Well, thank you one more time, council members. Anyone else? Dr. Moy, Ms. Alston, Mr. Resline, I want to thank you for your update. And again, once again, thank you for the work that you do every day to keep Harford County safe and moving forward.
All right, thank you.
Thank you.
At this time, council, I'd like to call to order a public hearing for Bill 20-006, transfer request. It's our pleasure to have Mr. Boniface, Ms. Lambert, and Mr. Sandless with us. Mr. Boniface, whenever you're ready, you're going to speak to the amendments as well.
Yes, sir. Thank you. Good evening, council. I also have Mr. Amos when we get to the Ag Preservation Bill. We'll be here to explain that one. So we'll go ahead and we'll start off with Bill number 20-006, which transfer request, which is really a two-part bill. The first part is dealing with a special pays when we pay out leave payouts at the time of retirements. Every year we budget for this across all three funds, the general, the highways, and the water and sewer. It's an estimate. And sometimes we're under, sometimes we're over. If we don't have enough, then we come to you in the spring and request an additional appropriation throughout the various funds that need it. And so we can get through the fiscal year. A lot of times this is for the sheriff's department. They accumulate a great deal of leave, and when a deputy leaves after his service, it's usually a big payout. This year, we've had a significant retirements, especially in our water and sewer division. I mean, our DPW division overall, and a lot of 30-year employees are leaving with some huge leave payouts. So we are requesting an appropriation to get us through the remainder of the year. The second part to this bill is in the original request, we were asking for an appropriation moved to our Emergency Services Division, the Disaster Recovery Fund, to deal with COVID-19 related expenses. We have a group of amendments this evening that we're asking to be introduced that I brought over to you the other day. Since we have local governments are receiving an appropriation out of the CARES Act funding, we won't need that appropriation from fund balance. So the amendments will do away with that request and yet ask for a request to create two grant funds, one within the Department of Emergency Services and one within Community and Economic Development, so that the money that we receive from the federal government through the state, half of it, of the 44.5 million, now 44.5, that we are to receive, half of it will go to the fund that we created in the Department of Emergency Services that will be used for COVID-related expenditures. We, the county, have expended almost already $3.5 million expenses. but it will also be for reimbursement basis for the municipalities, the local volunteer fire companies, and the health department. So that money would be available in the grant fund in that area. We're administering that through our budget office, and we're just now getting that program up and running. We haven't received the money yet. Supposedly, they say the check's in the mail, and we're supposed to get it this week and get settled up. The other half is being put into the community and economic development, and we are currently working at the county executive's direction at creating small business relief grant programs that he'll be announcing more information about at the end of this week. We hope to get up and running next week. These will assist small businesses that have been affected from the pandemic and hopefully help them, with their start backups and dealing with the new reality of social distancing requirements and so forth. One of the stipulations is that if you've received funding through a federal program for this already, you're not eligible. But there's a lot of folks, a lot of businesses that have not been able to do that. So we hope this is going to help them. So stay tuned for information on that will be coming out. We will have an element of that for the farms in Harford County, Mr. Schroeds. We're going to have it to help Harford farms out. So that'll be part of it. So you'll hear more from the county executive on Friday. So that's what those two parts of this bill do. And did I miss anything?
No, I think they covered everything.
So with that, I'll open it up for questions on that bill.
And if my memory serves me right, did you say that any of that money that wasn't used by December 31st had to be returned?
Currently, that is what the stipulation is. We're creating these funds and we'll disperse the funds from it. But we're on the small business side, we're going to use everything up to try to help everyone out and get started up. And you never know, things change on a daily basis. So right now the stipulation is we have to use it by December 31st. But we'll see.
Very good.
We cannot use it for revenue loss. That is one of the biggest sticking points we have at end. You have anything to add to that?
No, yeah, exactly. Cannot be used for revenue loss. Has to be used for things that really weren't originally part of your budget and things like that. So definitely a lot of restrictions on how it can be used, but certainly expenditures that we're already making and it would be nice to be reimbursed for them.
Very good. Thank you. Council, any questions at this time for this particular bill? All right, seeing none. Is there anyone signed up to speak, Ms. Dixon, from the public?
No, Mr. President, we have no speakers.
All right, then this will conclude this portion of the public hearing for Bill 20-006. And Mr. Boniface, if you'd like, we'd like to roll right into Bill 20-007, LoSAP enhancements.
Thank you, Mr. President. I'm going to let Mr. Samuels handle this.
Yes. Council President, members of the council. So this bill is basically a change in the benefit structure of the LoSAP program. In essence, a $25 increase per month for most of the recipients of the LoSAP program. So currently, for the first 25 years, members of that are eligible to receive the LoSAP benefit receive $12 per year, and then this increases that number to $13 per year, so 25 additional dollars. It also increases the cap of the overall LoSAP program because once you do the 25 years, you can do 6 years for the subsequent years until you get to a cap of 450. So for those individuals too, the overall cap is going to increase to $475 from $450. So a $25 increase per month more or less equates to about a 8% increase for the baseline number of $300 going to $325, and then for those individuals at the max at the $450, you go into $475. It's about a 5.5% increase. So right now we have about 500 individuals that are currently receiving benefits, and so this increase extrapolated to them would equate to approximately $150,000. Now some will receive a little bit less than the full 25 because surviving spouses receive half of the benefit. There's also some individuals that are eligible under like a modified kind of senior program that if they don't have the 25 years, but they're 70 years old, they can receive benefits with 10 years. But for most of the individuals, they'll be receiving the full $25 extra a month, which equates to $150,000. Now, there is no budget impact in fiscal year in fiscal year 20, and this will begin with the July payments again in fiscal year 21. So there's no immediate budget impact in fiscal year 21. We have a trust fund set up, a trust fund that is about 85% funded, so we have more than enough resources in there to cover that expense. But in the future, when we do our next actuarial study and the like, then we'll take into consideration this change in benefit structure, along with a whole host of other variables, such as how the stock market's been doing, how mortality rates and are doing. And our estimate right now is that that will, beginning in the fiscal year 22 budget, increase annual expenditures by about $260,000. But again, this is all will be paid out of a trust fund with funds that are set aside specifically and can only be used for LoSAP.
Thank you, Mr. Samus. Council at this time, questions? Mr. Woods.
Thank you, Mr. President. So the actuary studies, when it's dealing with the amount of the payout going forward, that changes on a regular basis. And can you explain the part to me that why the county doesn't pay into it on a regular basis? I mean, this administration has. Previous, they missed a couple of years, and future administrations obviously could skip a year or two, I guess you could say. Can you explain why that is and how that is going about, considering how this administration does the right thing and pays into it every single year regardless at some level? What happens if the next administration doesn't? You know, that's a concern.
Yeah, I mean, ultimately, you can afford to not pay your annual required contribution some years, but eventually it catches up. And the idea really is that you shouldn't just be paying for current expenditures for the current individuals receiving benefits, but you should also be putting aside money for the future individuals. So as I said before, there's about 500 individuals that are currently receiving benefits, but there's another about close to 1,500 that will could receive future benefits. And so we're putting aside money for those future benefits as well. And then what we do is we put it into the trust and then we invest. And the idea, of course, is that it'll be cheaper in the long run, because instead of just having it sit in the county's account where we're making less than 1% interest, we're able to put it into the stock market, which of course under normal circumstances is producing much better results, and other types of long-term investments. And because of that, then we're able to draw down from those investment gains in the future. So of course, you don't have to fund your annual required contribution. It's certainly a favorable thing. It's the same thing we talk about with our OPEB conversation, and why it's important that we do fund those future obligations, because they really are about current levels of service. And it's certainly something that the credit rating agencies look very favorably upon. Each year when I go up there, we all go up there, we talk about how we fully fund the annual required contribution for all of our pensions, the sheriff's pension, the state's pension, and then also our OPEB plan and LoSAP plans. So it's good financial management.
Yeah, absolutely. I agree with that. About 12 years ago, I guess, when I can't believe it's been almost 12 years ago when I was fire chief, I think there was about $18 to $20 million in the fund. Now it's what, 31 million plus, somewhere there. What
exactly? Yeah, about total assets about 36 million.
And that rapid increase, because if you look through history, the money hasn't increased that much. Is that because of not just this administration paying into it, but is that a relation to the stock market or
yes.
Good investment?
Yes. So each time when we make our annual required contribution, you're in essence you're covering your current payments, and then you're putting that extra money into the investments. And we have an assumed rate of return of 6% for our LoSAP trust, and we've been beating that 6%. And so that enables us to, in essence, sometimes have a lower arc in the future. If you keep on funding it, and if you meet those expectations in the stock market, you will quickly get to a higher funded level. So right now we're about 85% funded. That'll probably go down a little bit as some of the stock market corrections and things like that. But it's a very healthy fund.
Right. Now, every year or so I get, especially around this time of year, I get questions about from the fire service about the fund itself and what happens if we go to a full paid service. Does that money just go away and go into their pension, or would it just disappear, or could the county just do away with it? I try to explain the best that I can that no, that's not a reality. You know, it's a separate fund protected by state law that it will be in there. But can you elaborate on that a little bit?
It's a trust. So once we put extra money into this trust, it can only be used for these purposes. And so even if that were to happen, you would still have a lot of individuals that would have had prior service that we would then use this to pay their prior service. Now, theoretically, what happens if you no longer would have any of that years and years to come? I think that's more or less an academic point. But we certainly have the resources there to continue paying. So when we say we're 85% funded, that's more or less saying that we can fund 85% of the benefits that have already been earned. And so we are in good shape there in order to pay those future benefits.
Yeah, that makes perfect sense. The final question deals with what the association drafted, I guess, a while ago, and some of their requests that were, especially some of the non-monetary requests. As much as I'm supporting this, the increase, of course, I think it's a good move. There's nothing else that they brought up or asked for was in there, and that wasn't one of the things either. I guess the first question is, how did we get from what the fire service was asking for to this part of the increase? And then the second part of that question is, what happened with especially the non-monetary requests that they had in there?
So there's been various changes that's been requested over the years, such as lowering the age and a few other ones. As far as the non-monetary ones, I'm not. Which ones are you talking about in that regard?
Primarily changing certain things from what? Yeah, some of the things like changing the names from drills to training, so it just makes it a little more flexible. Changing the points, 2 points a year, or I'm sorry, 2 points a month for officers and elected officials and committee chairs, from being now, if I take a committee and it ends at 11 months, instead of I finish the whole year, I get no points for that. Or if something happens and I step down from that seat, whatever. One of the requests was to make it you get 2 points every month you serve in that seat or that office. Of course, the asking for it to be defined, so it's definitely paid for all the time. Changing some of the age requirement. I don't really, as I talked to you before, I don't quite understand why we would have to put the 16 years of age to be eligible to enroll, but that is one of the requests the fire service asked for, because we don't spell that out in the law right now. Things of that nature.
A lot of times those things will have financial, some financial repercussions at some level, just upon how the actuarial studies would be done. The big one was lowering the age from 55 to 50. And of course, at one point it was 60, and then it was lowered to 55 back in 2007. And that certainly has had a rather substantial increase in the annual retirement contribution. And so all of this is, it's still subject to kind of annual budget appropriation. And so if we start increasing our ARC, then that is fewer dollars that can be used for other things, including operating expenses for the volunteer companies and the like. So there is a little bit of trade-off there. I mean, this decision was made with the county executive. This is what he wanted to do, kind of in recognition of that there really hadn't been a COLA or adjustment. The $12 an hour and the $4.50 cap had been in place for many years and had not been adjusted, and wanted to probably just recognize that the time was now to make that adjustment and to take care of those individuals that have served.
Mr. Woods, I know that the association had met with the county executive and gone over many requests. With what was appropriated in this year's budget that's before you now, and this change, which they will heartily support it, they were very pleased with what we were able to do for them. So, they were very satisfied.
Right. This is obviously giving that fund a raise is definitely welcome. There's no question on that. So, but very good. All right. Thank you.
Thank you, Mr. Woods. Any other council members? Mr. Giangiano.
Thank you, Council President. Thank you, Mr. Sandless. Councilmember Woods had asked you the question about the now I'm having a brain. Being sick still on medicine gets me. Long term, okay. Can't think of what I was going to talk about, so I apologize.
It's okay, Councilman. You, when you think of what it is, send Mr. Sandless and Mr. Boniface a note, okay?
I will do that. Thank you.
All righty, sir. Anyone else?
Good to see you, Tony.
I'm here. I don't know about being seen, but I'm here. Thank you.
Ms. Dixon, do we have anyone signed up for this public hearing?
No, Mr. President, there is no one signed up.
All right, then with no one signed up, this will conclude this public hearing for Bill 20-007, and we will roll into Bill 20-008, Agriculture Preservation. Mr. Amos, it's good to see you.
Good to see all of you. I'll get started started with the bill on page 1. This is looking at the criteria, agricultural preservation easement size criteria. As you know, it takes 50 acres to participate in the program, or there is contingencies. Number 1, the contingency is 50 acres or greater. The landowner, number 2, the landowner adjoining property of less than 50 acres, but joined together to come into the program. And 3, which is going to be deleted as part of the change in the bill, predominantly agricultural area. I think of these changes as we're going to go through, we had some concerns of the general ag population, administration, the county council on various things, and we wanted to make sure all our farms coming into the program were top quality and ready to go if they're on the ranking list. If some of them were, that will be a few be eliminated. E, section permitted uses. This is just a cleanup because over time the zoning code has been rewritten, reorganized, and this is just clearing up to make sure it's in the right section of the code. On page 2, G, and tenant houses, it's the same thing. Because of the over time, we're making sure it's in the right section of the code. And then the gist of our changes for you to review is dealing as presented on page 2. The entire ranking will be changed. So what we did, it was deleted, and you go to page 5 where it starts off, and I'll go through the changes. On page 5, line 3, the soil productivity score, that remains the same. As you know, our ranking is a 300-point system. So 1/3 of it is the soils, and everybody reviewing it and proposing changes wanted to keep this. The importance of the soils for future farming on these properties is very important. So that was kept the same. When we went into farmland capability on line 5, which was 50 points, we dropped that to 35. You'll see as we go down later, those points were used to weight another section heavier. So this section, as you see, as you go down through on the right-hand side, was to eliminate 10 points from each of the sections. To give you an example, cropland pasture, 75 to 100% was dropped from 35 to 25, and so forth in that section, as you see. As we go down to line 14, under land use capability, that's where we added those points back in. It was 75 points, we added 90 points. And each of these sections, I'll explain where that weight actually went into. Under line 15, under development rate factors, we switched back from the original back in 92 and went back to actual development rates. We had switched about 10 years ago back to a percentage of the total. Now we're actually going to address some concerns of some individuals that wanted to see actual development rights and weight those development rights in more weights. So in that section, we actually went to a number of development rights, as you see. On line 23, we go into the proximity. It used to be called consistency with county land use plan. Now it's just being adjusted for proximity to priority areas. That was 30 points. We're adding 10 points to a 40-point max in that section. In that section, I'll explain that under A, line 24, designated rural legacy area within 2 miles. That means the legacy area and the area within 2 miles of that would receive 5 points. It was 10 points, but you'll see why we did that on page number 6. Under B, an agricultural designation on land use plan stays the same. That would mean anything outside the development envelope. Under C on line 3, the priority preservation area was 30 points. We're dropping that to 25 points, again, changing the weight a little bit there. And then the new section, D, within 2 miles of development envelope, really goes back to the original bill in 1992, that not only was preserving a large area in a rural area, but also trying to preserve a buffer area around the development envelope. And I think we've all talked about the pros and cons of that. And this bill actually takes you back to that. So it's 20 points if you're within that 2 miles of the development envelope. Again, that's new, and where some of our points win. On line 6, under farm size, we've doubled those points. They were 15 for 200 acres plus. Now they're 30. And so forth as you go down there. Again, that's highlighting to make sure our points go to large farms first, trying to pick those properties up because we know how important they are to the agricultural industry. Moving down to line 10, protected land contiguous to the site, all stays the same. 30 points as you go down there, everything stays the same. On line 19, existing soil conservation plan approved by Soil Conservation District, and then we added forest management plan approved by State Forester. The reason is we've gotten some, as you know, over time, properties that are all wooded. We wanted to make sure if they're doing the right thing, having a forest management plan, that they actually get points for it. And the corresponding points follows down the rest of the page on number 7. And then the last page really addressing our ranking, our new ranking. Everything stays the same. The ownership, the contribution to continued viability of agriculture, and the special conditions all stay the same. So that's it quickly, and I'll be glad to take any questions you might have. Thank you.
And Mr. Vincent, if I could add just real quickly, because you said to bring it up now, but later on there's an amendment for your consideration for introduction. During our process, we recognized that there were occasionally some properties that maybe did not meet the 50-acre requirement, that were not adjacent to a preserved farm, but were adjacent to a federally or state or local government property that was compatible with agriculture. And we didn't want to isolate those properties from being eligible to be ranked and possibly come into the program. So the amendment will clarify that if a property is greater than 25 acres and adjacent to one of these properties, then they are eligible to come into the program also. So that's for consideration later on.
Thank you, Mr. Boniface. Thank you, Mr. Amos. Council members? Mr. Schroeder?
Sure. Thank you, Council President. Good evening, everyone. As you know, this is something near and dear to my heart, land preservation, and I just thank you for bringing this up. I think that I feel strongly that I guess over time it is important to look at this, look at the land use maps, and make adjustments such as this. And I think that this will do us very well in prioritizing around our development envelope areas by providing a green belt to the more rural areas. So I know in the past there was an emphasis, especially in the priority preservation area and in our rural legacy areas. But remember back when those rural legacy programs began, there was an emphasis that you had to meet certain goals in each of those programs. Now we can look and see the great work that has been done and, see those preserved properties in those areas and see that we are on track to meeting those goals. So I do feel that by focusing in these other areas, it will actually give my colleagues in their districts, hopefully more preservation opportunities in their districts. And, I've looked over this. I think that y'all have done a really good job with it. And Mr. Boniface, if you would pass this back to the county executive, that I thank him for bringing this up. And also, it goes very well with the budget and the historic amount of money that's going to be in the program over the next year. So I think that this, along with the funds, I'm hoping that we can kind of transition to, look at our land use maps a little differently and preserve some other large contiguous blocks of viable and very productive farmland. And also, Bill Amos, thanks for all of your work on this and your years and years and years of getting this program out to the public and, really bringing the best farms to us. I couldn't be more prouder of looking at our land preservation maps, but I think this is going to take us into the future. I don't really have any questions about it. I understand this very well, and I'm optimistic that this is a step in the right direction. And of course, there may be adjustments that need to be made in the future, but that's with all planning and land use planning and zoning. That's just how it goes, and it evolves, and we need to adapt to the new future. So, again, thanks for bringing this up. As other council members may talk, I might have a question that might pop up. But as for right now, the legislation that you've brought to us, I'm pleased. I did think of one quick thing. Mr. Boniface, if you could ask the county executive, I would like to be added as a sponsor to this legislation.
Sure, Mr. Strode, I'll ask him, but he appreciate a call from you too. You give him a call, but I will pass it on to him. I'm sure he'll let you on.
And Councilman Strode, thank you for, but as you know, it's a team effort of everybody, council members, administration, of going and preserving these farms for the future. That's for sure. Thank you.
Thank you, Mr. Strode. Council members, anyone else? All right, there being no one else. Ms. Dixon, anyone signed up?
No, Mr. President, I have no one signed up to speak this evening.
All right, with no one else signed up, this will conclude our last public hearing for the evening. Thank you. We'll take a little bit of a recess before we start our regular meeting.